The title of my study is The Effects of Palms of the Hands Mindfulness Technique on Physical Aggression in Children with Down Syndrome. While typically developing peers display behavioral problems, there is an increased risk for children with an intellectual disability to display behavioral and emotional problems. Dickens et al. Examined the differences in maladaptive behaviors across 4 age groups using the Child Behavior Checklist and found significant effects within the domains of aggressive behavior, delinquent behavior, withdrawn, and social problems. Results suggested that social aggressive and delinquent behavior was significantly higher for 10 to 13-year-olds. An effective form of contextual cognitive behavior therapy that has been shown to reduce problem behaviors is acceptance and commitment therapy, also known as ACT. ACT is comprised of 6 core processes including diffusion, acceptance, present moment, self as context, committed action, and values. All ACT techniques are centered on mindfulness. Harper, Webb, and Rayner suggest that mindfulness is used in ACT procedures to help draw their attention to the present moment while being curious, open, and accepting. Singh et al. Conducted a study using the present moment technique of mindfulness to alter the trend of physical aggression within an individual with mild mental retardation and mental illness. The mindfulness technique, Soles of the Feet, involved averting the participant's attention from the physically aggressive thoughts to a neutral part of his body. The participant is instructed to maintain a natural posture, focus on his breathing, wiggle his toes, feel the texture of his socks against his feet, and feel the soles of his feet on the floor until the physically aggressive thoughts have subsided. Results from the study indicate that Soles of the Feet was effective in decreasing physically aggressive behavior during treatment and the 12-month follow-up. Although previous studies have established an effective mindfulness technique, the present study investigated the generality of the neutral body part to be used. Effective generalization will strengthen the social validity of the mindfulness technique. The following intervention's purpose is to determine if the mindfulness technique of palms of the hands will decrease physically aggressive behavior in children with intellectual disabilities, specifically Down syndrome. In the present study, the participants include 3 children clinically diagnosed with Down syndrome whom have a history of physically aggressive behavior. Each child has a mild intellectual disability that ranges from 50 to 70. The ages of the participants range from 10 to 13 years old. All 3 children attend different schools, and the sessions were conducted in their school's designated special education classroom. The participant and special education teacher were the only 2 individuals in the room during baseline and intervention. The classroom was furnished with 3 round tables and 8 chairs around each table. Hazardous items were removed from the room prior to baseline to ensure the participant would not injure themselves or the teacher. In the present study, observers were placed behind a one-way mirror in an observation booth to reduce reactivity of the participants. The observation booth was equipped with 2 home theater speakers to ensure that the observers could hear the teacher during the intervention. Each observer was provided with a clipboard data collection sheet, a pen, and a pre-recorded audio interval counter for recording data. Trained observers used data collection sheets to record the frequency of the target behavior. Partial interval recording was implemented by dividing each 45-minute session into 90 intervals of 30 seconds. Target behavior of physically aggressive behavior was defined as 1. Physically striking another person with an open or closed hand intensely enough to make a sound that can be heard from 10 feet away that is not a high five or a pat on the back. 2. Physically striking another person by extending the leg and foot with enough intensity to make a sound that can be heard from 10 feet away that is not swinging legs back and forth while sitting in a chair because feet do not reach the ground. Or 3. Mishandling an object by exerting enough force to tip the object over, or physically holding the object above the abdomen and releasing the object with enough intensity to land 10 feet away. A multiple baseline design across participants was used to evaluate the effectiveness of an ACT procedure in decreasing physically aggressive behavior within a classroom setting. The procedure was conducted over a 12-week period with sessions 3 times a week for 45 minutes each during the morning hours of the school day. Diffusion of treatment was controlled for by having the children attend different schools and communicating to the parents that they cannot implement treatment at home as well. Prior to the procedure, all participants were given a consent form stating information about the intervention. A signature was required from all parents, and a signature from each participant was optional based on their writing abilities. During baseline, the special education teacher was instructed to conduct her normal day-to-day lesson plan with the participant. The teacher was not informed of the intervention prior to baseline to ensure that she did not alter her behavior toward the participant while engaging in the target behavior. Observers recorded the frequency of physically aggressive behavior during baseline conditions. Following baseline, special education teachers underwent 4 hours of training for 2 days. The palms of the hands intervention was taught through presentations and role plays. Each teacher was scored using the procedural reliability checklist at the end of training. Procedural reliability for all 3 teachers was at 100% during training. Following the physically aggressive behavior in the intervention phase, the teacher directed the participant to focus on his posture. The teacher then instructed the participant to notice his breathing before informing him to reflect on the incident that caused the target behavior. After allowing the aggressive thought to flow through the participant's mind, the teacher instructed the participant to shift his attention to the palms of his hands. He was instructed to move his fingers, feel the texture of his pants against his palms, and feel the pressure of his palms resting on his thighs. This was continued until the participant's mind was cleared of the physically aggressive thoughts. Social validity questionnaire was administered to the special education teachers and participants following the completion of the last intervention session. 3 months following the completion of the intervention, data was collected on physically aggressive behavior. Follow-up sessions were conducted for 2 hours every week for 2 months. Results from the current study include Ryan having an average of 12.22 physically aggressive behaviors during baseline sessions, Alexander having an average of 15.17 physically aggressive behaviors during baseline sessions, and Tyler having an average of 8.96 physically aggressive behaviors during baseline sessions. All 3 participants' baseline data exhibited no trend with a high stable level of responding. Results from the current study include Ryan having an average of 4.41 physically aggressive behaviors, Alexander having an average of 8.22 physically aggressive behaviors, and Tyler having an average of 4 physically aggressive behaviors during the intervention. Results during the follow-up showed that all 3 participants exhibited an average of near 0 physically aggressive behaviors ranging from 0 to 2. Results from the social validity questionnaire completed by the participants show that they thought the procedure was easy to participate in, that their physical aggression had decreased since the start of treatment, and they would recommend the procedure to a friend. Results from the teachers show that they enjoyed implementing the procedure, that they believed the procedure was effective, and they would implement the procedure in the future. The present study extends the findings of Singh et al. By demonstrating that physically aggressive behavior can be effectively decreased by mindfulness procedures. Results of the current study suggest that following the implementation of palms of the hands, all 3 participants' physically aggressive behavior decreased to an average of near 0. Palms of the hands was generalized from Singh et al.'s soles of the feet mindfulness procedure, further indicating that A limitation of the current study includes dates of birth not being examined before the onset of intervention, ultimately leading to threats of internal validity by maturation. Another limitation includes the education subject of the lesson not being controlled for, which may be a threat to construct validity and impede the interpretation of the results. Participants may also refuse to engage in the mindfulness procedure and continue the undesirable target behavior. Thus, a future study may want to measure the latency from the teacher beginning the procedure to the participant engaging in the procedure. The external validity of the current study may be enhanced by future studies examining larger sample sizes. Even with these limitations, results from the current study are consistent with previous studies. Findings from the present study indicate that the palms of the hands mindfulness procedure was effective in decreasing physically aggressive behavior in children with Down syndrome. Here are my references used in this PowerPoint presentation. Thank you for listening.